Doctors say that contributes to the disparities. Joining us now live via Zoom is Dr. Gwendolyn Clayton. Thank you so much for being with us this morning.
Absolutely. Thanks for having me again.
No problem. So earlier and yesterday we talked about and you mentioned access to food and healthy food that contributes to the health disparities surrounding diabetes. What about lack of access to affordable health care? How does that contribute and what can people do about it?
So that is an absolute huge component of our overall health, our access to healthcare. It depends on where you live. It depends on what you have access to in terms of health clinics and insurance. So what can we do about that? If you don't have insurance, there are low-cost options. There are free clinics in the area that people can reach out to. There are social workers in the area that also can assist with getting good quality health insurance and then therefore good medication access.
Very good options there. Now, what are the long-term effects for someone who may have diabetes if they don't get checked by a doctor?
So long-term effects of diabetes are basically damage to the small as well as the large vessels of the body. And that can over time lead to heart attack, stroke, problems with the kidneys, neuropathy, which a lot of us see are leading to things like amputations and sepsis and hospitalizations and ultimately, unfortunately, death.
Wow. So it is important to definitely go to those annual checkups. I know yesterday we were talking about, you said about 6 months ago, not a lot of people were actually going to their checkups, but you're kind of seeing a turnaround now, right?
Absolutely. People are starting to make their appointments. We've seen that they may not have been seen for a year and a half, but they're definitely coming back either in person or still via telehealth if they're not comfortable coming into the office.
That's good to hear. Now, some patients are diagnosed with pre-diabetes, right? So what does that mean and how does it actually differ from a type 2 diabetes diagnosis?
Right, so prediabetes is definitely an elevation in your blood sugars, but not to a degree where you're diagnosed with diabetes, which is a specific cutoff. We typically order blood tests. A very specific one is an A1C level, and those at a 6.5% or greater are diagnosed with diabetes, but those less than that are considered pre-diabetic.
Let's talk about that historical aspect. I know we talked about how some people don't even go to the doctor because of that history when it comes to medicine. And that contributes to the disparities that we see, especially attributing to diabetes, right?
Absolutely. You know, it's important. We teach a lot of our medical students to know their history and know the history of persons of color in this country and their feel about medicine in general. Because if you don't know your history, you can't relate to your patient and overcome those disparities and those myths. Actually, they're not myths, but today we want to help break down some of that historical darkness that we've experienced in our country and move forward. I still have patients today that refer to that. We have to work through that, and then together we have to come up with a plan for their better health going forward.
I think you said it best, Dr. Clayton. You said you got to build trust with your patients, and the patients got to trust the doctor too. But I've been telling people all morning, you got to get to the doctor to build that trust. So hopefully that's where folks will start. Thank you so much, Dr. Clayton, for your time this morning.
Absolutely. Have a great day.
Thank you. You too. Now, tomorrow morning, the